electrolytes are very important. So when we see that's imbalance, one thing that also really is important is that uses electrolytes is our adrenals, which adrenals guess what? Produces energy. It produces cortisol. That has to do with our energy. It also produces our stress hormones that can contribute to the fatigue as well. Hey, what's up, my health enthusiasts? Dr. LeGrand here for another video. And today we're going to be talking about fatigue. Now, I know there's a huge problem that a lot of people have here, especially in the US, but I know it's a problem all over the world. I deal with this. So I'm a family doctor out here in the state of Washington, and I see this problem all the time. I would say probably about 60, 70+% of people that I see that come in do have some shape or form of fatigue, low energy. And the biggest issue is that when people come in, so we're going to talk about what can contribute to it, what is the root cause of the problem, trying to find the root cause of the problem, and also how to treat it. So first diving into, when people are dealing with fatigue, they go and see their doctor and they're dealing with fatigue. They're dealing with low energy and they run different tests, the typical tests that could be contributing to fatigue. And these typical things are going to be, for women specifically, they're going to look, okay, are you anemic? Maybe you have a thyroid issue, or there might be some hormone imbalances, or maybe an infection, something like that could be contributing to the fatigue. So they run the standard blood work and they come back, you look fine. They tell you you're fine, everything's great, you're just healthy as a horse, but deep down inside, you do not feel fine. You do not feel like how you used to be, because you want to feel like how you used to be, but your doctors are telling you so you think it's all in your head, and they're telling you it's in your head. This is always a problem I see, that patients come in because they've seen tons of different doctors, different specialists, and getting the same answer. The problem is it really has to do with a lot of different things that can be contributing to the fatigue situation. So I mentioned a few that are typical ones: the anemia, thyroid. Another big one could be malnourishment. Malnourishment can be a big issue that can contribute to the fatigue. If you're not digesting your foods properly, of course, that's going to contribute to some kind of low energy. But when going back to thyroid, this is the problem, is with thyroid issues, is most doctors will just run what they call as a TSH. And that's the thyroid stimulating hormone. It's something that will produce right up in the brain and then stimulates the thyroid. It isn't the thyroid hormone, it's the hormone that our brain produces to stimulate the thyroid. Now, the reason why they run that test, because it is the most sensitive test to really kind of rule out thyroid problems, but it doesn't rule it out completely. I always like to run a free T3 and a free T4 for the thyroid. Those are the thyroid hormones. And you should always ask your doctors to run a full panel, because sometimes there is some cases, and more than you would think, where TSH that I have seen, where TSH can be fine, but free T4 and free T3 can be out of balance. Why? Because there could be one thing, it could be the conversion of free T4 to free T3 can be out of balance because of the enzyme that actually converts that. It could also be somewhere else in the pathways, what I call peripheral thyroid issues, because our thyroid is also produced or also in different parts of our body. Our liver does convert thyroid, our adrenals, our heart, our digestive system. That's what there could be, problems there, but our thyroid might be fine, but other parts that actually deal with thyroid hormones can be out of balance. So running all these different types of tests is important. Also, anti-TPO levels. What are those? Well, if you are having an autoimmune condition situation, which happens a lot, this is how hypothyroid patients become hypothyroid, is the body first initially is attacking the thyroid and destroying it. And that's where your anti-TPO levels go skyrocket, okay? And what we call that is Hashimoto's. So it's attacking the thyroid and destroying it. So if that's the case, a lot of doctors don't run those. Why? Because they just wait till the thyroid gets destroyed and see that the TSH levels are abnormal, then they put you on medications. But you can prevent that, not necessarily prevent it, but at least start changing your diet, changing things to ease the blow when you're in an autoimmune condition. I don't believe that you should just wait it out. I don't do that with patients, because the sooner you can actually tackle it, the better, to ease the blow of attacking the thyroid, of destroying it, and start getting to where the body can start healing the thyroid again. So when it comes to thyroid, definitely asking your doctor to run those. Again, that's TSH. That's the typical one they'll run. Free T4, free T3, and anti-TPO levels. The other thing to also look at is a comprehensive metabolic panel. So looking at a comprehensive metabolic panel, what that's going to show is electrolytes, look at liver enzymes, look at glucose levels, look at bilirubin, different kind of things that can see what might be out of balance. But the big one is the electrolytes. So fatigue can also be contributed to imbalances of electrolytes. So why is electrolytes so important? Well, our whole body runs off of electrolytes. It's kind of like the fuel. It's how our brain communicates with our body. It's how our digestive system, different sodium potassium channels that open and close to communicate to get things moving, say with our muscles. So electrolytes are very important. So when we see that's imbalance, one thing that also really is important is that uses electrolytes is our adrenals, which adrenals guess what? Produces energy. It produces cortisol. That has to do with our energy. It also produces our stress hormones that can contribute to the fatigue as well. So when you're running a comprehensive metabolic panel, seeing if the sodium potassium ratios are out of balance, there's also further testing that I do to look at electrolyte imbalances as well. But if that's the case, then supporting something like the adrenals and also adding things that increase electrolytes and also bone minerals. Bone broth is great. Those are things that you can start contributing towards that. So you want to make sure you're checking that. The other thing is also looking at malnourishment. So looking at proteins, fats, and carb breakdown. So as we get older, our digestive enzymes that our pancreas produces start decreasing. And when this becomes an issue, when you have malnourishment, because you need food, the body needs energy, and it gets that from our food. And if it's not breaking it properly, you're going to start to feel fatigued. Okay. The next big thing as far as that could be the root cause of the problem is looking at other hormones. So we're talking about testosterone, estrogen, progesterone. Now, when doctors run these types of tests, they're going to run, of course, your typical reproductive organs. But the thing is that the liver actually does help with hormones a lot. Same with adrenals. Those things, all our endocrine systems have to dealing with hormones. So our endocrine, of course, is the thyroid. The adrenals are also our organs, our reproductive organs, all deal as far as an endocrine system with hormones, but also our liver does process hormones. So if we have an underperforming liver, that could be also contributing to the fatigue situation. And then, of course, looking at if our reproductive organs are underperforming, especially for males, if testosterone levels are low, that can also be a contribution to the fatigue situation. So now, how do we actually treat the situation? So I'm going to kind of go over just the big ones. I mean, like I said, I can't cover all the scenarios, but these are the typical ones that I do see when patients come to see me of what's going on. So the first one is thyroid. So if you do suspect a thyroid situation and your doctor only ran TSH, I highly encourage you to go back, and especially if you have a lot of the typical hypothyroid, types of symptoms, to have them rerun the test to be able to at least run the T4 and T3 and also the anti-TPO levels. If that's the case, I'm not a big fan of the big typical, Synthroid type of medication that they put hypothyroid patients on. I actually really like things such as like Nature-Throid. MP thyroid is more of a natural form of the desiccation of the thyroid, and it also can be used as a decoy for the antibodies that is going on from your body. Now, what that does, of course, is avoiding from the body attacking the thyroid consistently, so allowing it some time to heal. I've been able to successfully get patients off of their thyroid medications. Now, not everybody can, but it is possible if you implement good eating habits, different things and lifestyle changes, as well as getting on the right types of medication. Another great thing that I do like is also from Standard Process. It's called Thytrophin PMG. It's a light form of natural desiccation. It's a way to start implementing it as well as a promorphogen to use as a decoy from having the body attack the thyroid. So then when you're diving that, the other thing is also looking at what also could be contributing. It isn't always usually the thyroid, in my opinion, and what I've seen with my patients. Usually they have a thyroid issue that could be contributing to fatigue, but something else. So diving in the adrenals, like I talked about, if I see electrolyte imbalances, I'm suspecting that there is some adrenal issues, as well as if there's imbalances in their blood pressures, that has a lot to do with adrenals with blood pressures, also with heart rate, things like that can also, if their stress level is really high, you want to be able to implement something to support the adrenals. So something like adrenal desiccated, just like thyroid desiccation, you can actually get that from a standard process to be able to help that. And I see this, especially if this is the case, people see night and day with their energy because they've been feeling fatigued for a long time. It's because as we get older, our adrenals really get exhausted over time. And I know there's a big, huge, argument about this, that the conventional doctors are saying, oh, there's no such thing. Well, we do have the adrenals, and they do with energy and stress. So we should be looking at them because it does contribute a lot. And by just implementing that, I see through my patients where they feel so much better on that because they've been dealing with this issue for a long time and not be able to find the answer. So that's something you can implement. But then also going back to the electrolytes, making sure that we're implementing good amounts of electrolytes. Also, Ligaplex 1 from Standard Process has what it calls bone broth in a pill, has lots of great bone minerals, collagen, things like that you can incorporate on a daily basis, but as a supplement until you start using food for your medicine, and that's what I would recommend. The other thing that you should consider is going back to the malnourishment situation, so how treating that. So that goes back to if you suspect that you're dealing with malnourishment, you're not digesting your food, especially if you have digestive issues, most likely you're not actually digesting your foods properly. So incorporating something like pancreatic enzymes to help digest your foods, but also looking at the stomach acidity, okay? If your stomach acidity is low, it's going to have already a hard time breaking down the foods. So what do you do about that? Well, you incorporate something like HCl, hydrochloric acid, to be able to help break down your foods. And this also, if you deal with acid reflux, you might be dealing with low acidity or high, depends. But I see it more often where usually people tend to have lower acidity and those kind of issues. So we start implementing HCl to help digest our foods and help with the fatigue situation. The other situation that could be also is going back to really the hormone imbalances of our reproductive organs. So making sure that you run the right tests, having your doctor run the right tests. So running a full panel, estrogen, progesterone, estradiol, testosterone, FSH, LH, all those different things that could be out of balance in implementing those. But also remember looking at all the endocrine systems such as our liver, adrenals, thyroid, our reproductive organs, covering all bases of hormone balance. In most cases, that actually is what's contributing to the fatigue situation. It could be also the malnourishment that I just did talk about. So what are ways that you can actually prevent this? Well, it goes back to, of course, foods. So implementing a good, well-balanced of foods that are rich and dense. We live in a society where we eat too many dead foods is what I call it. So a lot of high processed foods, high processed carbs, sugars, things that aren't really sustainable foods is where we hit these high, spikes of blood sugar and energy, and then we crash. But eating things that are more rich proteins, rich meats, fats, vegetables that are very nutrient dense, that are sustainable foods that can sustain our energy. This can help with get good quality sleep, do meditation to help regulate our mental emotional imbalances. That can help. All these kind of different things. I don't have all day to talk about all this, but I just want to share these few tips. If you guys have any more further questions about fatigue, go ahead and leave that in the comment section below. As always, if you have not checked our channel before, go ahead and hit that subscribe button right here. Check out our other playlist. Until next time, this is Dr. LeGrand signing out, and I will see you in the next video. Thanks. Bye.